Brilliant. Good afternoon, everyone. And I'm going to whiz through these because I'm sure over the last couple of days you've seen lots and lots of stats. So we are the Mental Health and Productivity Pilot. We're a Midlands-based programme that's been commissioned by the government to try and understand the link between mental health and productivity. That productivity puzzle that anyone's grappling with at the moment, we're trying to understand from a research perspective how mental health and productivity actually join up and what are the challenges they're facing, both small businesses but also large organisations too. You've seen a little bit around statistics, I'm sure, over the last few days, but really importantly, lots of news at the moment to say that mental health is pretty stable across the board, but actually what we're seeing is actually that it's started to increase again now. And over the period of time, over the last sort of 2.5 years, particularly during COVID, it's raised its head. And lots of firms are reporting mental health related sickness. So if you can imagine large firms, large organisations with lots and lots of people, lots of mental health related sickness absence, but actually what you're also seeing is now that lots of people are starting to report lots of presenteeism where people are turning up for work but not necessarily presenting as sick. And that's also important for us. And it's amazing actually to understand that actually whether that will be the same whether it's a large organisation or a small organisation. But our experience at the moment is that small organisations are starting to feel that a little bit more because people want to stay in the workplace even though they're not well at this particular time. So mental health at work, the picture for us really is lots of open conversations going on. So it's great from the last presentation and the one before. Lots of people are talking about mental health in the workplace. So really, really great to see. But actually, as you can see down the bottom of the scale, lots of organisations haven't got mental health champions or mental health first aiders. They haven't got executive level board support for mental health, but also very little around having a mental health plan in the workplace. So less than sort of 30% of organisations are suggesting that at the moment. That's really worrying for us, really. And we've talked about the statistics on the right-hand side, but actually we do know that actually if you support early intervention in the workplace, it means that actually you're going to have reduced absenteeism, reduced presenteeism, and workplace issues will actually blend across the workplace as well as spilling out at home. And we've got a whole issue around spillover, which is starting to take place at the moment around those things that happen inside work and outside of work impacting on the workplace. So started just to think about adoption of budgets, line management training, depending on the level of the organisation. You'd imagine if it's a large organisation, have lots of policies in place to support organisations and support the employees. But actually smaller organisations don't. So actually you can see that sliding scale, which is really, really important for us now to think about how that works. Now that's come out of a survey that we did with 1,900 businesses across the Midlands, and we ran that. It finished the first 3 days before the first lockdown, and we've run it every year since. So really, really thoughtful now, starting to think about what that means for employers and employees. But actually, like you've heard in the last presentation, if you ignore mental health, actually, it has an impact on productivity. So people have a lower level of productivity. You're losing more days through poor mental health. You have higher recruitment costs. And actually, a couple of organisations that I'm working with at the moment have between a 15 and 25% turnover rate per year. That's a lot when you're starting to think about employee level at about 150 to 200 people. You know, you're looking at a budget of about 150 to 200,000 pounds just in cost around turnover, really significant. There's increased confidence, complaints at work and also conflict. So that may be impacting on your bottom line scores around net promoter scores and a whole host of other things. Really, really important for you as a brand. So really thoughtful about actually how do we keep that in play. And then actually have poor morale in the team. So it's really important that we look after all of this. We have a reach across the whole of the Midlands region, covering from Lincolnshire right the way down to Hereford and Worcester. So really large population of about 10 million people. We're supporting businesses across the Midlands, both at small and medium and enterprises, but also large organisations. And we're currently recruiting for an enhanced offer at the moment, which is a free offer to all businesses in the Midlands region that we'll have on offer until the 31st of March. And then we'll be working with organisations for the next 6 to 9 months. Really to think about how do we improve the mental health of the workforce, but also improve the productivity. Now, I've really still stopped through that. I'm just going to hand over now to Sarah. But as she's walking away over without managing, hopefully, to fall over. So we're trying to make sure that we work with organisations in the Midlands region. We're currently working with about 850 employees, reaching about 700,000 employees now. So it's about 17% of the Midlands workforce. And all of those things therefore lead to that improvement around better employment engagement, better morale, positive improvement around sickness absence. But actually, you can get hold of us via the mhpp.me as a website, and we can go through that later. But hopefully, as we talk about this today, and we'll talk about it with Rhia a little bit later.
Thanks, Sean. So I'm just going to talk to you a little bit more about mental health at work. So we are one of the programmes or interventions, if you like, that are offered through MHPP. But it actually doesn't matter where you are in the UK. It's a nationwide programme. It doesn't matter what sector you're in. It doesn't matter what size you are. Here are our aims to really help you think about those policies and practices and culture that Sean was mentioning earlier. How you build mental health literacy in your organisations, and then how do you start to work on that culture stigma piece as well, with the aim of positively impacting the mental health of your workers. The main framework we do this round is the mental health at work commitment. So this is a really simple framework to help employees create the policy, the practice and the culture and change around mental health that you need. There's 6 very clear standards. These were built out the Thriving at Work recommendations in 2017 that we did jointly with the government. And it really gives you support to understand like what best practice has shown is needed for a more holistic approach to mental health in your organisations. These are the 6 standards here, so anything from capability and confidence in your organisation to the thinking about the culture, what tools and referrals you provide to your staff, and how do you measure and really understand whether you're making a difference in your organisation. They're all included under the mental health at work commitment. It's not just the 6 standards, there is also then a whole package of support that is under there, and this is all available online. So we have a mental health at work website, which has loads of original content, tips, ideas, tools, blank templates for you to use, as well as loads of really unique content around intersectional issues, such as menopause and mental health, or neurodiversity and mental health. We also are piloting at the moment a brand new peer platform, so we're connecting mental health at work commitment signatories with each other to support each other in terms of what their best practice sharing and what they're implementing. So there's an opportunity for you to connect with other organisations who are signed up as well. We currently have 2,500 organisations, literally just hit that this week, across the UK signed up, representing 4.5 million employers. So this is a big movement of work, which has been funded now for 5 years by various bodies and will be continuing for a while. But we are increasingly seeing a number of SMEs sign up to the programme, which is really exciting for us. We're now 67% from SMEs. So it just shows that it has got the tools and the content that you need. And then we are also this year branching out to support those who are self-employed. So if you're a one-man band business, you will start to see way more content and resources available to help you think through your own work-life balance and the own policies and practices you put in place for your business. So what we're going to do now is I'm going to head back over to there. We're going to make sure we talk into the mic so you can hear us. And I've just got a series of interview questions, if you like, for Rhia. She's going to talk through her story about what she's done as a small business and how she's accessed these different programmes and what difference they've made. Thanks, Rhia. I don't know. I'm trying to look and talk at the same time. So firstly, if you could talk to us a bit more about who you are, Rhia, tell us about Access Bookings and kind of why you needed that support in the first place and why you reached out to the programmes.
Okay, so I'm the health and wellbeing and advisor for Access Bookings, and I work in the HR department. Access Bookings is a TV, film and media travel and accommodation booking specialist. It was established in the 80s by a partnership between Ian Taylor-Brett and Patricia Barnes. They were a couple that saw a niche in the market, started it up at home, and they've built it over time. pre-lockdown, we were at our busiest and our biggest in terms of like the corporation. Our recruitment drive had sort of increased massively, and we were doing really well. We'd got all our contracts and everything were all in place. We'd sort of hit our peak recruitment numbers. We were fully office-based. We had lots of employee participation when it came to mental health campaigns. It was a passion project of mine, bringing that into the HR role. So we would often have outside suppliers coming in to talk about a number of initiatives, campaigns, well-man clinics, well-women clinics. We had people braving the shade for Macmillan, all those kind of things. Lots of like staff participation, feeling really involved. We would often do sort of charity walks for Mind, for example, raising funds, raising money, and just getting families of the staff involved as well. So it's a very family-orientated business. Just prior to lockdown, we'd also arranged for, we had 50 trained mental health first aiders, the idea being that there would always be at least one person in every room that could pick up on things of the staff that were around them. So HR is great, we will always help and deal with things, but you know, the little nuances that people see day in, day out would help them to support them. And we had like wellbeing coordinators, so it was doing so well. We had like everything was all in place, and then COVID hit. So it didn't just wipe out the travel industry at the time, everything came to a standstill, but also all of our major contracts were either outdoor events, outside broadcasts, filming films. You know, you can't do a romance scene 2 meters apart. Everything just sort of shut down while they tried to figure out what that they could do, which meant that we were just hemorrhaging money at the time. Everything was sort of going quite badly, which is why we then had to start to look at initial layoffs and redundancies for our non-profit departments. We all loved the day that furlough came into place because we'd just laid off a lot of the staff. So we only had a small amount that remained working whilst furlough was taking place, while we worked through getting all the equipment out to people that they needed. It became apparent over time that COVID wasn't going away quickly. So we then had to start looking at large-scale redundancies and restructuring to save the business. We reduced the staff by around 60%, removing a lot of management levels, streamlining the teams that would remain. Because we've always been a family ethos, that really hit quite hard for our company. Line managers, heads of departments, directors all had that involvement with the staff. They knew them on a personal level, so it was really, really difficult doing that rescaling, getting people to sort of apply for roles that they had before. It hit badly, and obviously all being remote as well, you couldn't come together and talk about things in the way that you would like, because face-to-face is so much better. So there's lots of Zooms and calls, and you know, meaningful interaction kind of lessened a little bit. So what we found was post-redundancy and COVID, those that remained were unsettled, quite angry with decisions that had been made because they were their friends and their colleagues. There was guilt for those that remained, seeing that their friends and colleagues having to go for positions in an industry that still was recovering. It was hard for people to sort of gain work. And anger towards HR senior managers as to who had led that redundancy process, because you were the face of it. Didn't sort of matter about what was going on in the background. So all that previous excellent work that we'd done with the mental health and where we'd got to kind of diminished completely, and we were just on a completely different playing field. So that's when I started to look to see what we could do better.
That sounds like an incredibly challenging time. Were there other kind of contributing causes to sort of mental health challenges you were seeing in the SME sector specifically? Yeah, so large spells of working remotely at home. Previous confident colleagues were, the remote situation was chipping away at their confidence, their ability. Just the thought of coming back into a room full of people was really making them quite anxious. Reluctancy to return to the workplace, even just for a day, is quite prevalent. It still is, you know, we're still working through that. Sort of discord between those that were working and those that weren't. The experiences that they'd had throughout COVID and the pandemic was pretty large scale. And also, because we'd moved from being fully office-based to home, that feeling of always being available and on for work
was quite hard. And support for those that are supporting those with poor mental health. You may only have normally in a normal situation one or two, well, hopefully a handful of staff members that are sort of struggling that you're dealing with at any point. At that particular point and still ongoing, a lot of people have been impacted by the pandemic, and mental health is, for us certainly in our business, at an all-time high. So that support and resources for those supporting them is quite limited, which is quite difficult.
Totally understandable. From a barrier perspective, what are SMEs facing in terms of thinking about implementing mental health support in their organisation?
Funding. A lot of small businesses are rebuilding after the pandemic, trying to get back on their feet and prioritising the budget that they've got. So, for example, when you're researching good employee assistance programs to get the really good quality support, it comes at a price, and so it's sort of managing those budgets and seeing what you have to work with and where you prioritise putting that money. Education of leadership teams, unless you're self-educated or you've experienced mental health yourself, it's hard to know where to even start to find those resources. There are long NHS waiting lists, so even when you are encouraging staff, we all know that there's nowhere else then for them to go. So that's another struggle that you have as well, is you can signpost them so far, but what happens after that?
All negative so far, sorry guys. There's some good stuff coming. So bearing in mind all that you were facing and your employees were facing, just really interested in kind of your journey into the mental health productivity pilot. Like, what did it look like? How did you kind of make that decision into moving into that programme?
It was by chance an email sent to me by a colleague saying this sounds right up your street, and it was about the MHPP pilot scheme and being in the Midlands area, because we're a company that's based in Lichfield. I had a quick look on the link and he was right, it was right up my street, so I had a look further to see what that all entailed, reached out to Kate Wood, and that's where our journey started. She is so personable and so lovely. As a designated contact that I had at that particular point, she helped massively. She looked at everything in terms of the structure of what I'd got so far, took the time just in that initial appointment to get to know me, get to know the company, get to know the objectives that we'd been trying to set, what we'd done previously and what we wanted to do going forwards. And she just really helped me to strip it back to basics. So she used the mental health at work commitment to look at the structure for strategy, to see where we were fitting in all those pillars, and help me then just strip everything back to basics and look, right, where are the areas we need to be focusing on, because the workforce was so different now. And also my confidence had sort of taken a little bit of a knock. Part way through, you go from feeling like you're doing a really good job to suddenly like, oh my God, where do you start? The great thing was, initially, she did praise for all the things that we were doing right, and at that time, and sometimes it can feel like you don't know if you're doing the right thing at any point. So it's great to hear sometimes that you are doing good for people. So she was able to sort of praise and put that into the framework for us, establish where we were. And for her, we could have moved to the Thrive at Work straight away and go for an accreditation, but she understood that we wanted to make sure that we were doing the right thing going forward rather than looking at what we'd done previously, because we knew that wasn't existing anymore, because that world just wasn't there anymore. So she just knew that we didn't want to be a tick box exercise, and we wanted to put sort of meat on the bones. By taking all that time to listen to me on the many Zooms that we had, she was like my own personal counsellor. She was able to identify the area that we really needed to focus on, and that was supporting our management team. They themselves had been through such a lot in the processes that we'd had, and we'd found that they were probably quite shying away from staff a little bit because of the constant conflict that was coming at them, not knowing what to say, not knowing how to handle it, and just feeling like they just needed to say sorry all the time. So they were themselves struggling with their own mental health, but also struggling with where do we fit in this now and how do we help and support going forwards. So she was great. She set up training for all of the managers. And because we're a 24/7 business, she set up 6 different training sessions over 6 different times to make sure that she was hitting everybody so that they could all feel listened to, heard, have the training, and all be able to turn up for it and get the best out of it that they possibly could. Nothing was ever any issue. So she set that all up for us. Any check-ins that I have with her are really meaningful. Anything that I ask of her that I think this is sort of like an area that I need to look at, she's got a wealth of resources that she just pings me straight away. Whatever you ask, she's there and she gets in it. And for me, it has been amazing. I don't know whether everybody will get a Kate, but they'll get somebody similar to Kate, and they will hold your hand the whole way through and make you feel like you are actually doing a good job, and that you will be doing a good job for your employees going forwards.
Going back to the framework piece, why was thinking about mental health at work kind of framework for your organisation right for you? Why was that the right direction?
To make sure that, like I said, in terms of a tick box exercise, you didn't want to be there. You wanted to make sure that the content that you were giving out to staff was meaningful, that it made sense, that it was something that they could turn to, the resources were there, and that it could be a practiced, throughout. It's like a constant that's throughout the business. So it's not just like, we'll hit that this month or this week. It was about making sure that it's actually embedded into the culture. So that was really important for us to do that. A lot of the small businesses, like myself, the HR departments and the wellbeing departments aren't huge. You've got one person that's probably covering many, many, many different roles. So by doing this and using the resources that she had, the content that she would send, saved so much time, because you could pick out all the things that you felt were relatable to the company that you were in, and the people that you were underneath you, and it just saved those hours of research, which was brilliant, which meant that intranets can be up to date with the best information, the most up-to-date information, because it's constantly changing and evolving. So that for us was a really good reason to do that. Also, from a recruitment perspective, I cannot stress to you enough how much the mental health at work commitment actually brings people in to your business, knowing that you are going to support them when they're in there. We don't ask anybody to disclose any conditions that they have when they come for a job, but just seeing that logo on Indeed or when they're coming for a job like advertisement means that they don't worry about disclosing on the medical forms once they join that they do have a mental health condition or have previously suffered with a condition, or they're taking medication, because they know that it's a safe and open space to talk about, and they're going to be supported throughout with regards to that. And we do have like the feedback from those that we've recruited, just to say that they think that's absolutely fantastic, that's a big reason why when they're moving that they go there. Sorry, I talk a lot.
At a time where people have lots of vacancies, I guess that's a really good attraction to the organisation.
They want to know that staff will be looked after. It's not just about what benefits that they can get financially anymore.
Okay. Just conscious of time, kind of last question of the major changes that you made in the organisation and what you've seen as a result of those changes.
Okay, so conflict management was great, so we talked about that, and we've already sort of like touched on training for the managers and how to make them feel confident. But the other thing that she also trained them was the wellness action plans. I cannot stress again enough how amazing they are, if they're done right, and if they're done with the right intentions, with the person with you receptive to it. It can be the difference between them having sort of 6 weeks off work or being back in the workplace within an afternoon, because you know their trigger points, you know who they feel comfortable you talking to on their behalf, but they also know who they can come and talk to and tell that they're having a particularly bad day. There may be phrases that they don't like, which can trigger them even more. So, for example, we have one person where it's like, they just said to us, just ask me, how can I help you? And they'll just say, right, I need 5 minutes fresh air or whatever else. I know that that's training on the wellness action plans and guides all in the MHPP and the mental health at work commitment, and they're really great resources to have. The uptake on those and the meaningful wellness action plans has meant that our absence rates have gone down massively, which is huge in the fact that, we're just coming through the back of the pandemic. The changes as well, because of the constant resources that come through, we've been able to look into new policies. So we have a menopause policy, we have a mental health policy, domestic violence policy. We're now currently looking at IVF policies and looking at transgender we have a mental health strategy now in place where we didn't have before, which all comes off the back of that framework, which is great. And again, just sounding boards to say, is this right? Is this okay? Am I doing the right thing? Am I going in the right direction? Because it can feel quite overwhelming.
That's really great. Thank you for laying all that out. If you would like more information, if you're in the Midlands about MHPP, there's some information here, and got some flyers about mental health at work commitment. Has anybody got any questions that they want to ask Rhia or Sean from a more kind of policy strategic point of view? Anything that anybody would like to ask?
I want to ask a little bit more about how we actually measure things across the entire process, right? So when we start with making sure that, whatever we do is relevant. So first, how are we assessing the needs, both at individual and organizational level when we do this kind of initiative? Then how do we make sure that those needs are then met through the way that organization works, in a way that it's embedded in daily practices, not just a tick box exercise?
Yep.
And then finally, third is then how do we then kind of bring it back and measure the impact in terms of how we are measuring ROI of all of these impact initiatives, again, both at individual and organizational level.
So if I take that then, so that's, as part of our MHPP, we've got what we call an enhanced offer. So at the very beginning, we do a employer level assessment where we do a survey with the employer to understand sickness levels, presenteeism, leaveism, right the way through to what policies and procedures they have. We'll then send a survey out to all of the employees that will be anonymised and come through a research partner. When we get that back, we'll then do a baseline review with the organisation. So we'll have a baseline survey as to where organisations are. That will drive the activity that we do with the organisation and help to define what the need is and the demand is within the organisation and focus on the key priority areas. So as with Rhia, it went into the mental health at work commitment. If you identify that it might be some more musculoskeletal work or some things around physical activity or lifestyle, you might choose to go on the path of the mental health at work commitment, which is through the West Midlands Combined Authority accredited programme. We'll send a number of interventions. We'll work with the organisation for probably 6 to 9 months, and then at that point then we'll do a review of the baseline and then actually capture that data to understand all of that. As part of MHPP, what we've also done is we've run a number of feasibility studies and pseudo-randomised control trials where we've been able to identify return of investment as well as identify what works. So what we're trying to create now is a position of what the evidence base is for what actually works in a workplace, because I'm really mindful that actually during COVID lots of things have popped into the ether around mental health and well-being, and there are people who are selling things that actually aren't evidenced, and I'm worried that actually lots of things that are out there potentially could be doing harm. So we're trying to provide the evidence base now, a bit like the mind work behind the scenes is actually what we do is evidence based, it has a rigour attached to it, and therefore we can create a sense of mobility then for organisations going forward. So ensuring that if you were making any other business-based decision, that actually you'd have a complete structure around procurement and process around it. For mental health and well-being, what we generally do is ask our colleagues who's done this, that and the other, and therefore we say that might work and we'll adopt that. We're saying actually no, you need a business process by which we're now putting in place to do that. So hopefully that will give you some process going forward.
And I'll just add, if you're outside the Midlands area, so the commitment, you would see in Commitment 6 is all about that transparency and measurement piece. So we've got a whole heap of resources online about that piece, including a webinar for you to kind of think through how you might do an equivalent, set your own kind of baseline and really be looking at like data-informed practice individually in your organisation. I think, yeah.
Thank you very much,
We're done with that.
Sarah, Rhia, Sean.